Hi, this is Marcy White from Copley Acupuncture, and I just wanted to post a video today because I was feeling pretty inspired. I had a patient come in and we were treating him to help him quit smoking. Not many people know about the use of low-level laser for smoking cessation, and it is something that came to light and was fairly new to me about 10 years ago. I've been using low-level lasers in my practice for about 15 years for a variety of health conditions like neurological conditions, pain, and fertility. And I had someone call me and ask me if I would treat them using the laser to help them quit smoking, which I, had never really heard of. We certainly have acupuncture treatment for that. But they told me that they had done it 15 years ago and they quit in one session, which just sounded a little too good to be true to me, but I agreed to do it and did a little bit of research, and sure enough, they quit in one appointment. After that, over the past 10 years, I've had dozens of people come for this treatment. Most everybody has had really good success in 1 to 2 treatments. And why is this happening is a very good question. But basically, we're using something called auricular acupuncture, which is ear acupuncture. The ear in Chinese medicine and Asian medicine is called a microsystem, where you take a smaller version of the body, a small part of the body rather, and it represents the whole body. So if you look at the ear, it looks like a fetus in utero. So the head of the fetus would be where the earlobe is, and then this is the neck and spine. And the Chinese have been using it this way for many centuries. And basically this has been confirmed that you can access most any part of your body through the ear, and it's through the nervous system that this happens and is possible. You have nerves that come from your brainstem called cranial nerves, and one of the most significant nerves is called the vagus nerve, and the vagus nerve has 3 branches that come from your brainstem and pass through the ear. So when those are needled in acupuncture, they're activating your parasympathetic nervous system, which is the calm side of your nervous system, and it helps to deactivate that fight or flight response, basically. So when you're doing something to help quit a substance and doing auricular acupuncture, you do a combination of points. Some include that vagus nerve point, and then you would add in whatever points seem to correlate to the addiction. So if you were doing alcohol addiction, then you might want to add in some liver points and some kidney points in addition to the vagus points. If we're talking about smoking, you're going to add in the lung point. So basically what's happening here is that you are activating these calm regions of the brain to help with cravings and to help with the negative effects of coming off of a substance, the anxiety that could be induced by coming off of something that you have been addicted to for a very long time. So with the low-level laser, what seems to be happening, and why it, in my opinion, has much more success in a faster and shorter amount of time, is that the laser light is stimulating the nerve very precisely. We were able to control the exact depth of penetration of that light and pulse it at a frequency that activates those nerves. So when you're putting a needle in, it can do that same exact thing, but because this is such a small and thin structure, sometimes, in my opinion, you're going too far past the nerve and maybe not getting as strong of an effect. So most people that have come in here, again, have had success in 1 to 2 treatments, and it's definitely something worth trying if you've been struggling with quitting smoking. It's a very, very hard addiction to quit. So what I do is use this laser, and we take the probe here, which I use this for other medical conditions, and you can put a little attachment on it that makes it needle size, and then we pulse the light. So you do both ears, a set of points, and then we do some body points. It takes about 45 minutes. Most people feel very calm during this treatment and relaxed, and then we see how you do over the course of the next month or so. And I tell people that the minute that they start to feel any kind of craving, instead of trying to reach for a cigarette, to call the office and come in for a booster if they need one. But if you have any questions about this amazing treatment, let me know, and thank you for watching.